Sweet. All right, so here's the list of things that I would know about birds for the Natalie. Got a couple upstairs. Got an ILT. I guess that's the only thing we had upstairs. And a normal. Yeah, normal. So ILT, this is the herpes virus of chickens. So the chicken cold sore, if you will. I mentioned to someone upstairs, they don't have lips, so they get ulcers in their trachea and their larynx instead. So this is also called fowl diphtheria. So the gross presentation is going to be similar to calf diphtheria, right? Ulcer, fibrinonecrotic goop onto the ulcer membrane that peels off. Little diagram.
So the term diphtheritic membrane is when it exudes out.
So the diphtheritic membrane is because this is the lesion of diphtheria, human diphtheria, right? So diphtheria is just like this term we made up for this type of lesion. Like this is diphtheria because it looks the same, right? Makes sense. Anybody know what diphtheria is?
I know I get vaccinated.
It's like calf diphtheria, but for people, right? That makes sense? It's a different pathogen. It's a cryni bacterium. All right, so yeah, pseudomembranes, caseous plugs. This is like a cast of the trachea made out of fibrin that's just kind of like sloughed off. This is what a dyspneic chicken looks like. They open their mouths and they kind of gasp and gape, and they'll also extend their necks. They'll stick their necks out. Avian influenza, so follows the influenza rules. We're especially worried about high path here, and we're kind of in the season. We get a lot of testing coming through the lab for high path. Flu, migratory waterfowl are the reservoir. So if you keep chickens and ducks, please do not keep them together. That's gross. This is a severe multisystemic disease. So it primarily causes vasculitis. You get multi-organ involvement. Here's cyanosis and severe edema of the column and wattles. These cyanotic or hemorrhagic lesions on the feet. The lesions are highly variable. Sometimes they can with acute death, basically. So pretty much every dead bird that comes through the lab right now during certain seasons gets tested for avian flu. Infectious bronchitis. So this is a respiratory coronavirus. Similar principles in chickens as with respiratory coronaviruses and other species. It has high mutation rates, so that's kind of a coronavirus thing. That's why we've had to get so many boosters for COVID because it's mutating. And coronaviruses in animals typically are difficult to control even with vaccination because of that mutation rate. There are also some nephrotropic strains, so we can get nephritis. Looks pretty similar to the diphtheritic. This is mucus. Actually, this is not a diphtheritic membrane. See how the trachea just looks kind of too wet and too red. So this is just some tracheitis and edema and then some catarrhal activity. Mycoplasmosis follows the rules of mycoplasma as it does in mammals. So more common presentation. Chronic respiratory disease that is resistant to antibiotics because it's mycoplasma, they don't have a cell wall. And then these can also disseminate to other organ systems. So you can have infertility, ear infections, sinus and respiratory infections, and then joints can also be affected. Turkeys are usually more severely affected with these, so don't keep your chickens and turkeys together because that's gross. Diagnosis is by PCR. So some mycoplasmas can be cultured in the lab, but it takes a long time. This one is super fastidious, so PCR is just easier and probably cheaper. Aspergillosis, as I mentioned, this is really, really common in birds, especially captive species and especially things that need a wet environment. So waterfowl anywhere and penguins in zoo environments. This causes granulomatous pneumonia and air saculitis. So I have a lot of questions about the normal bird respiratory system and air sacs. Here's a normal air sac right here. Do you see this clear, transparent thing? They're literally like a cell or two thick. There's almost nothing there. It's like tissue paper. This is an inflamed air sac full of fuzzy, fruiting body fungus, right? So you've got fungal infection inside a space that communicates with air that's developing these fuzzy conidia. So this is classic air saculitis. Normal air sac, super thick, like 1,000 times too thick. Here's what that looks like in the lung. So here are all these small granulomatous lesions, all these little white dots. So extension of disease, usually air sacs have it more severe, but this will eventually extend into the lung. So it can either go by just direct extension or by through the respiratory tree into the lungs. So very common to see both, but often the air sacs have the worst of it. Cryptosporidium is a GI parasite in other species, but in birds, it's a respiratory pathogen. So it's primarily opportunistic, not often a primary pathogen, but it can cause sinusitis, tracheitis. This is a bird with severe sinusitis, and the periocular sinus is very swollen, so it makes his eye look really swollen, big. Crypto in mammals, zoonotic. Crypto in birds, not zoonotic. You're safe. Respiratory, not zoonotic in birds. Here's what those look like. So this is a cytology of some respiratory epithelium. And crypto is interesting because they are intracellular, but extra cytoplasmic. Think about that for 1 second. I'm gonna try to draw it. This confused the crap out of me. It was like, how can they be inside the cell, but outside the cytoplasm? Never know until I get a better marker. Okay, so here's a cell, is bounded by a membrane, right? And it is filled with cytoplasm. Crypto is right here, inside your membrane, but outside your cytoplasm. So it's in your cell, but it's not really in your cell. That makes sense? So on cytology, what that looks like is, here's all the cell's cytoplasm, and they are these little round blebs sticking off the top of the cell. So they are definitely inside the cell, but they are outside of the cytoplasm. Applies to all crypto, not just bird.
So like right up against
Right up in there, yeah.
but not in the bilayer of
Not in the bilayer, they're under the bilayer. Cytoplasm. Just trust me. All right, air sac mites. These are cute. They're often harmless unless you have a lot of them. So here's a close-up of an avian air sac, and all these little tiny brown guys are little mites. This was a Goldian finch I had. They're apparently very susceptible. Something I learned in residency by putting up a lot of them. Never did with air sac mites. But the host range is pretty broad. So usually an incidental finding, but they're fun to see when you open air sacs and you're like, why are things moving? There's some thought that they might predispose to avian birds. All right, the gape worm, Syngamos trachea. So this is the tracheal worm of birds, primarily turkeys, chickens, and geese, but other birds can be affected. And in young birds, lesions are usually most severe. So I've never seen this in real life. I'll tell you how common it is. Maybe it's regional. I don't know. But these guys are interesting because the male and the female are actually permanently fused together, so they can just have babies forever and ever and never have to stop. And they form this Y shape. So this is the female. Here's the little male, like parasitically hanging onto her, and then the female will actually grab on to the trachea, and they will just hang out there and do their thing, and then the bird can't breathe. So they will gape like this. Chicken in respiratory distress. Stretching his neck out. So that's why it's called gape worm, because they can't breathe. There's too many worms. Okay, so tracheal obstruction, the syrinx. You guys all find the syrinx in lab?
Sorry, is that behavior the same as in the herpes virus? with the open mouth, or is
So
it?
this is a bird in respiratory distress. Yeah. This is yeah, he's having a hard time.
Open mouth. Got it.
He's straightening out his trachea to make it a straight shot, and he's opening his mouth. All right, whatever. Okay, so do you guys all find the syrinx on the bird upstairs? Yes, no, you know what the syrinx does? Right here, so this is a tracheal bifurcation. And you see how it's pinched here and here? So in a mammal, these are just straight tubes. Right here at the bifurcation in a bird, it's pinched. Here's a better view. Right here, right here, right here, right here. That is the syrinx. This is the voice box of the bird. They don't have vocal folds, they have syrinx. And that's how they make all their oral sounds. I had a parrot, so he used his syrinx to great effect. Very loud. So because of this little pinch structure anatomically, this site is predisposed to developing obstruction, especially with inflammation in the upper airway. So that makes this a really good sample to take for bacterial culture. You could just cut off above and below the syrinx and this little mucus plug in there. Great for culture. Nice. Delicious. That's it. Now we can review on Friday. Yay! Questions?